preventing overdoses is a high priority. Nichole?
All right, Evan, thank you for that. Well, new today, Pennsylvania Senator John Fetterman back in the hospital, checking himself into Walter Reed today to treat clinical depression. The Democratic senator is still recovering from a stroke he suffered last May and voluntarily opted for this inpatient treatment. Fetterman's chief of staff says he's experienced depression off and on throughout his life, and it became more severe in recent weeks. So joining me now is Dr. Daniel Bober, a psychiatrist, and Dr. Thomas Pitts, a board-certified neurologist. Thank you both for giving us some of your time. Dr. Bober, we'll start with you. Talk about the significance of this announcement from an elected official.
Well, it's very worrisome. You know, when people become hospitalized for depression, it's generally for two reasons. Either they're acutely suicidal or they're unable to care for themselves. Hygiene, eating, drinking, not getting out of bed, unable to function. So obviously, this is very concerning, and it's something that he needs to be treated for aggressively.
And Dr. Pitts, we know Fetterman has had health complications involving his stroke. Could it be that this possibly complicated or fueled this most recent diagnosis, or this stent now in inpatient treatment?
Thanks for having me, Nichole. For sure. I mean, depression is the most common mood disorder after stroke, and it comes from two things. One, loss of function. You see he has appendicular weakness in his arm and speech issues, but also from the actual damage to the frontal or sometimes frontal temporal lobe itself, you can have dysregulation of mood. So absolutely the stroke played a role, but I like that he's normalizing getting treatment for mental health disease. My compliments to him.
Absolutely. Dr. Barber, we know that about 1 in 4 American adults suffers from a diagnosable mental disorder. So kind of what type of treatment is there for clinical depression, and then clinical depression for inpatient treatment?
So we know that up to a third of people who have a stroke will develop depression, but there are very good treatments for depression. Depression is like any other medical illness. While we're talking about diabetes, hypertension, heart disease, there are very, very significant rates of remission from things like medications, for example, selective serotonin reuptake inhibitors, psychotherapy, all have very good evidence. Obviously, when someone is unable to function or acutely suicidal, they require inpatient treatment for 24-hour monitoring and much more aggressive treatment that can include everything up until electroconvulsive therapy if it's very, very significant or severe depression.
All right, last question, and I want you both to have an opportunity to weigh in. There's obviously the question about his ability to serve his constituents. Dr. Pitts, we'll start with you.
You know, I think it's a little early to comment, but I would tell you this. I mean, if I hurt my arm and I played a sport, I would get diagnosed, treated, and my plan would be to return to work. And if he gets appropriate treatment, I can only speak from experience that I've seen plenty of people resume their lives. What is more concerning is if you hide it under whether it's stigma or whatever, and you don't get treated, that you see downstream issues. So I really compliment him. And like Dr. Bober said, you know, we have excellent treatments nowadays, both in stroke prevention and in depression therapy as a mood disorder itself and as a sequela of stroke. So I absolutely would say that no one could count him out from doing his job at this stage in the game.
And Dr. Bober, will quickly throw it to you.
I agree. I think him being elected was insurmountable to some people. I don't think they thought it would ever happen. I think that he could really be a beacon of hope for a lot of people suffering from depression. There are very good treatments. He should be able to resume his life with aggressive treatment. I've had my own patients who have been, non-functional, unable to get out of bed, having to bring them food and hydration, and then they go on to be full-time students and have a full-time job. So I've seen it happen many times, and it can happen with him too.
Yep, there's absolutely a light at the end of that tunnel. All right, Dr. Bober, Dr. Pitts, we thank you both. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider, and don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.